truly identify them is by having them, you tell me what this paper says, and then I'll say if you're the correct patient or not.
Okay.
So in that sense, so we'll use that as a
Oh,
requisition.
thank you.
And then I'll just make up, I'll just say my name, and then I'll pick date of birth, as long as you're looking at the paper rundown.
Okay.
So how would you ask?
So again, my name is Janine. I'm going to be your phlebotomist for today.
Okay.
First thing, I just want to verify your full name and your date of birth.
Okay. And then you can say something like, can you please state for me your full name and date of birth?
Okay, so can you please state your full name and date of birth?
Okay. My name is Romel Lasco, date of birth October 6, 19 something.
Okay.
Okay. So let's say it matches down there. Now, if it matches, then you can proceed with the draw. You could usually just put the requisition or the label right next to the patient, or just somewhere around there. Fine.
Okay.
Yeah. So if you're working with other coworkers too, just be careful of placement. Like let's say if there's another chair here, or sharing the same table, make sure you have a designated space just for your own requisition. Because worst case scenario, if you put it close here, your coworker has their requisition, they could swap it. Okay. So try to maintain like a certain area just for only your requisition only. Okay, so in this case here, we'll just put it here on this side here. Okay, so you already verified the patient?
Yes.
Go ahead and proceed.
Okay, so I'm going to sanitize first
Okay, perfect.
before I feel for your vein.
Okay.
Okay.
Oh, here we go. Yeah, this is like the manual one.
Just make sure my hands are really.
Yeah, because usually with if it's moisture or even hand sanitizer, when you put the latex glove especially, it will tug on it, like it's really hard. Yeah, so you can just air dry it easier.
Okay. Now I'm going to get the tourniquet.
Okay.
And I'm going to apply it 3 to 4 inches above the puncture.
So when we talk about consent, like when I stick out my arm, what kind of consent is that on the patient? Like when I don't say anything, but I give you my arm.
Just
There's a
body movement.
yeah,
Unconditional?
So there's a certain type, the term for a consent. So it's called what? It's implied consent.
Oh.
Implied. Okay. That's good. Yeah, good placement. So yeah, bunny ears, good tension. Okay. And then once you apply the tourniquet, you would have the patient.
So I just need you to close your
Good,
fist
perfect.
like this.
Okay, good.
And then you said just
Yeah,
touch
just
on the
below
bottom or
or above. Yeah. But when you do stick, just stick where the crater's at. Yeah, you can't miss it.
okay.
Yeah.
So I feel your vein.
Okay, good.
I'll just untie the tourniquet.
Okay, good.
Place it here, and then sanitize again.
You don't have to. So since you found the vein already, you can put on your gloves, or yeah, put on your gloves to clean the site. So go ahead and put on your gloves, and then you're gonna sanitize my arm with alcohol.
I'm gonna put on the gloves. These are big for me.
Okay.
It's okay.
There's, if you want this one,
Okay.
this is I'll have Mr. choose with the small. To allow the student to use the small.
Usually very small, sir, right?
Say again.
The smaller, the better, right?
Yeah, so
Yeah.
if you wear
Yeah.
a certain size, just one size smaller.
Small.
Yeah,
Okay.
yeah. Cause me, I wear, like if I'm feeling for veins, I wear medium. But if I'm just regular, like holding samples, I just wear large. So yeah, so it's just so there's no wrinkle lines on the fingertips.
Okay, so gloves are on.
Okay, gloves are on. Okay.
And I'm going to put back the tourniquet.
Or actually, you're gonna wear gloves because you're gonna clean the site.
Oh yes.
Okay. So go ahead and clean the
Just
site.
kidding. I'm gonna clean the site first.
Clean the site. And then for clean the site, what's the direction, or how do you clean the site?
So I will go inward.
Okay, inside,
And then
going
outwards.
out, nice. Okay, and you could do it as a big ball. Oh yeah. So when you do clean, go inside, going out, but don't go back in again. Yeah.
Oh,
And then just go out. There you go. Perfect. Just like that.
okay.
There you go. Okay, good. And then go ahead so this is gonna air dry.
Mhm.
So while it's air drying, what can you do?
So
while it's air drying.
prepare the equipment.
Okay.
So I got the tourniquet there.
Mm-hmm.
Then my needle will be here.
Mm-hmm. Or you can assemble actually.
I can assemble that.
Yes. So when you assemble it, I know it. So you're gonna actually on this part here, you're gonna hold untwist the white portion because this
Okay.
white portion here will thread into there. So when you do it, you just twist and then pull out because there's a seal
Okay.
that's there, the sticker. So you would have to just break the seal and then pull the white cap out,
So
just the white
twist
part.
and
Yeah.
then-
There you go.
Okay.
Okay, that'll expose that one. Then you can get your hub and then thread the hub into there.
Here.
Yep. Okay.
Okay.
There you go. That's good. Okay. You can set that aside.
Yeah, put
And
this
then,
here.
yeah, there you go. Okay,
And
so
I'll
you
get-
have the rest of your supplies. You have your gauze here. You have your alcohol. You have your
My
tube. Yeah, so go and get your tube. Okay.
So my
And then set
tube-
everything close to you. There you go.
My tube will be
Okay.
here.
So everything's good within reach. Okay. So now you're ready. So go ahead.
Okay.
What do you do next?
So I will apply the tourniquet again.
Okay.
Am I pinching you?
No.
Just
It's
let me know if you're in pain.
fine. No, you're fine. Okay. Then the bunny ears.
Oh,
Okay.
great.
Yeah, it will pinch your glove. It's fine.
Okay.
Yeah. Okay, that's good. There's still tension on there. Yeah. Okay, it's tight.
Right.
Good.
Okay. Okay, so I feel it there.
Mhm.
So I'll get my needle.
Okay. So before you can go ahead but don't uncap it yet. Just practice
Okay.
like holding your position pretty much.
This is lifted or
Yeah, it's lifted. Yep.
it's lifted like this?
Mm-hmm. Okay. Okay, so good placement. Okay, so with this one, just make sure your thumb is not in the path of the needle.
Okay.
So you could actually, it's when you anchor it, you could actually just pull the skin this way is fine. It'll
Okay.
still hold it, yeah. And then this is perfect placement here. So your 3 fingers on the base, 15 to 30 degrees perfect. You have your anchor on your thumb. So just like this, how you're doing it. Okay?
And then I just insert the needle like
Yes, exactly.
that.
Yep.
Okay.
And then just take your time. Don't be nervous. And then just stick whenever you're ready.
Okay.
Okay? So yeah. So whenever you're ready, just go ahead and uncap.
Okay. So I feel the vein here. And I will uncap the needle.
Yeah.
Okay.
Okay.
And just anchor.
Yep.
And this is 15 degrees.
Yep. Perfect. Okay. Whenever you're ready, go
Okay,
ahead.
I'm
Switch.
going to put the needle in.
Yeah. Go ahead. Perfect.
And
Okay.
then,
Oh, sorry. I forgot to actually switch the. No, that's fine. Okay. Yeah. I'll give it to you.
and then, I was supposed to grab that.
No, you're fine. And then use the push with your thumb, and then your finger. Yeah, that's it. That.
Push.
There you go. And then keep an eye on this one here.
Okay. Oh shit.
No, you're good. Okay. So just say this is the last tube. Before you remove the tube, what do you do with what you're supposed to do?
Before I remove the tube,
Yeah.
I just untie the tourniquet.
Perfect. Okay.
So this is the last tube, sir.
Okay. Go ahead and you're fine. I don't feel anything.
Okay.
So when you remove it, just twist it going out, but make sure the needle doesn't come out.
Twisted going.
Going out. Yeah. There you go. And pull out. Make sure this is still in here. You're good. No, I don't feel anything. Okay.
Then I'll just
Invert.
invert it.
Nice. Okay. So just sorry, I forgot to put your supplies on this side. Okay.
So put the tube there,
Okay.
and then I'll just apply the
The gauze.
Okay.
Okay.
gauze on
And then
top.
you could fold it one time already. Go ahead, fold it
Okay.
one time and then place it on top. There you go, just like that. Perfect. And then pull out. Okay, good. Okay, and then have me apply.
Okay, so I just need you to press on the gauze
Okay, good.
for me.
And at the same time too, when you do the needle, do it one hand with your thumb.
One hand with my thumb.
Yeah, close it. There you go.
There you
So
Yeah.
apply the safety device.
There you
you
go.
go.
Perfect.
Mm.
Okay, so once you already do the safety device, what do you do with that needle?
I dispose it.
Yes,
Mhm.
directly into the sharps. Okay, yeah, perfect. Okay, good. Okay, so once you dispose in the sharps container, what do you do next with your tube?
I label it.
Okay, so you get the sticker, you label it,
Yes.
and what are the 3 things that you write down? So go ahead and write it down.
So I'm just gonna put the date and time.
Okay, date
So
time,
today
today's
is
date.
10/12.
Okay,
2020, and the
Okay.
time is
Beginning? Okay.
Today, sir, we're doing, my name is Gilbert and I'll be the one drawing your blood. Can you please state your name and your birth date?
Sure. My name is Romel Lasco, date of birth 10/6/89.
And check. Okay, sir. Here. Right.
It's always good to make the patient see that you're actually hand sanitizing
Yeah.
as well. So even though you do it, but they don't see you, they have a tendency to like, oh, did you sanitize? Or you give them a sense
Yeah.
of, you know,
The cleanliness.
you're following
Yeah.
cleanliness and also protocol.
Mhm.
So I'm gonna give you. Oh,
Okay. Please. Can you check the other?
okay. You can try this. It's fine.
Okay, sir. Just gonna look for your vein.
Okay.
Start inches. Is the pressure good?
Yeah,
sir?
it's good. It's good. Yeah. Yeah. There you go. Okay. So what else can you do? Like when you put this one here, what can you instruct the patient to also do?
Sir, can you make a fist?
Okay. Perfect.
Okay. Okay, let me find your. Fine. Yes, no, you can.
Yeah. So this one here is a bit difficult. So
Yeah.
if you like roll it this way too,
Mhm.
you can feel it like here on this side, like here. Like if you're, or put your position your finger this way, like this way, and then try rolling it, and you could kind of feel that little.
Oh, there. I
Yeah.
got it now.
Yeah.
But I can use the other hand, right?
Yeah, you can. Yeah, definitely. Yeah, definitely. Because I know
now-
some people when they feel like this, it's very limited. But if you feel like this way,
Mhm.
it gives you like you can feel a lot more.
Okay, now I'm
especially on the
ready.
side. Okay.
Ready to take it
So
out.
you have your line of sight
Yes.
here. Okay.
Mhm. Okay.
Okay.
Then my gloves. Hey.
Oh yeah, it happens. Yeah. Okay. Okay. Yeah, you could just you could just go ahead.
So use alcohol. Okay, sir, I'm just gonna sanitize.
Okay. Okay. And another tip too, before you put the alcohol, you could try filling one more time. I know there's no tourniquet, but it'll give you an idea where it might be at. So you can just try filling with the glove where it could be at.
Okay, this one.
Okay.
Mm.
Okay. And just go inside, going out. Just do a big circle. There you go. Perfect. Okay.
Alright, sir, that's all right. I'm just
So
gonna
that's drying. What can you do?
assemble my supply.
Yes, assemble supplies.
Check the supply.
Oh, actually,
this one.
You know, this is a. Oh wait, this is a needle. Yeah.
Okay.
So the difference between this, so you guys know, these are the same needle
Oh.
because they're green.
Mhm.
This one has a safety device. This one doesn't have. So just to differentiate between the two.
Okay.
So you can use this one now.
Okay, so I'm checking.
Okay. So
It's already
Seal.
it's already cut. Or is-
No. No. It's. Yeah, it's using another one. Yeah, I don't think it is, but
Oh.
it's okay, just in case.
Okay.
Yeah.
Okay, and just assemble.
Okay. Okay, onto the end. Perfect. Okay, good.
Okay, thank you. Just put the tiny stuff here.
Okay. Okay. And sometimes too, you could have you could tell the patient to hold the tube for you. It's fine too.
Okay, now, sir, I'm just gonna play a tourniquet.
Okay. This is not in the way, right? I want me to move it back, or is it right here?
Yeah.
So we see it more.
Space.
Is there the pressure is okay?
Yeah, it's good. Good tension. It's tight. Nice.
Yeah.
Okay, especially it needs to be tight on this arm because you do this by not by sight. This is a bit more difficult, so it's more on feel. Okay. So as long as you have tight tourniquet, they're holding a fist,
Okay.
and then since you clean the site, you can touch either below or above.
Sir.
Okay. Okay. So whenever you're ready.
Okay.
Okay. Good placement.
Okay.
Okay. Good.
Okay, so
There you go.
okay, sir. Then just one more time, just to make sure.
Okay.
Okay. Sir, I'm just gonna put it now.
Okay.
Remove.
Good. Okay, so what you can do is you could just try to readjust. So you just put it right up, not until the bevel comes out, and then go this way, and then go in again. Okay, go back out. Or try. Okay, so you readjusted, and then go ahead and go this, or you pulled out a little bit, right?
Yeah.
Okay, good. And then go this way a little bit,
So just
or no, swing this way,
adjust it here.
or I
Yeah.
feel a little bit of that.
Right side.
Yeah, so you go this way a little bit, this way, there you go, and then go in.
Oh,
No,
sorry.
you're fine. Go in.
Okay.
There you go. There's something. Yeah. Okay. So usually it's here, or it's kind of tricky on this one here. So sometimes you hit it, sometimes you don't. But if not, so we'll just pretend. So pretend the tube is filled already. So before you remove the tube, what do you have to remove first?
The
Okay,
tourniquet.
Okay. And also too, like when you remove the tourniquet, always keep an eye on the needle because the needle tends to come out when you pull the tourniquet. So perfect. So go ahead and remove the tube. Okay, keep an eye on the needle. Make sure it doesn't come out. Nice. Perfect. And then you invert. Okay, go ahead. Set down, and then go ahead and get your gauze. Okay. Okay, good. And then pull out your brake, and then apply pressure. Activate. Okay, good. Okay, and directly into the sharks. Okay, so I'm applying pressure. What do you do with the tube?
Okay, I'm just gonna get the label.
Okay, label.
In the
Put it
tube.
on. Okay, and then go ahead and write the three things you're supposed to.
So 10, 12, 20,
Okay,
and time 9 o'clock,
okay.
and
Then
my
your
initial.
initials. Okay, so since you have that, so go ahead and give that to the tech.
Okay,
Okay, just drop it off. Okay, so you have the tech. So, well, after you're done
put
labeling,
the band-aid.
okay, band-aid, perfect. Okay,
Okay.
band-aid's on here.
Alright, thank you so much, sir.
Okay, release the
And
patient.
we're done, and I can release you now.
Okay, perfect.
And after that, all my stuff.
Yep. Okay, so everything, your supplies, put it all in your hand. Just ball up your hand. Okay, and then once you ball it up, remove the glove and then the other glove too as well. Okay, perfect. Then throw in the trash, and then after that,
Sanitize.
hand sanitize. Perfect. Okay, just like that. Okay, so it has to be in that.